every program is sort of like, an autonomous machine. And I don't think a program needs a director for education per se. And I know that's a very profound and probably controversial statement. But I personally feel, and I feel strongly, that the role of the program director is to cultivate culture. It's to cultivate culture of the program such that when a trainee is able to graduate from the program and work independently, that trainee is no longer just a fully fledged cardiologist, but becomes a role model in society, a role model to those who I perceive to be the most important in our society, and those are the kids.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. This is a continuation of the mini-series that Dr. Anavekar and Parallax have put together for our audience and for the listenership. And for those of you who haven't listened to the first two episodes of the mini-series, I highly recommend that you go back and listen to those before you jump in on this one, because the effort is to have the series put together in a continuum. Not that you can't listen to each of these episodes in and of themselves, but I do think that listening to the first two will give you a better perspective of the third one. So with that preamble, it's my pleasure, honor, and delight to welcome back Dr. Anavekar on Parallax. Dr. Anavekar is professor of medicine at the Mayo Clinic, and he's the program director of Cardiovascular Disease Fellowship program, arguably one of the finest training programs in the country, if not in the world, in cardiovascular medicine. He's back with us on Parallax. And the focus of our discussion for this episode is going to be a topic which Dr. Anavekar lives every day, and that is postgraduate medical education. And when we were putting these series together, he, graciously reached out in an email and laid out some of the topics he'd like to be covered, and postgraduate medical education was one of them. And it was both fascinating as well as thought-provoking for me to read what he had to say about postgraduate medical education, because he was comparing how postgraduate medical education, or education in general, used to be, back in the day with, with a symbiotic association between the learner and the teacher, and how, with modern times, it has sort of become skewed more toward the teacher becoming the celebrity. But I should stop here and let Dr. Anavekar pick up, because he's very learned on this topic. And Dr. Anavekar, welcome back on the show, and thank you so much for doing this for us.
Not at all. And I hope by this stage you can just call me Nandan. I think we're good friends, and I consider you, even though we haven't met, I consider you, as a brother. And just for your, listenership, what I would say is now in the last 4 to 6 weeks, I've had a chance to go and listen to a lot of the other episodes on this podcast. And I've got to say, if you're listening out there, I would take this podcast not as, something to enjoy, but as something to learn from. I'm learning so much from all these episodes and the amazing guests that Ankur has been able to cultivate. And it's profound. It just shows how complex the world is, our profession is, how many different interacting factors. And this is an amazing learning experience. So I just want to make sure that I've conveyed my gratitude to Ankur for all the work that has gone into this effort. So thank you very much, Ankur.
Oh, no, the very kind words, and thank you, Nandan, for sharing your feedback on other episodes of Parallax. I'm sure as much as it means to me, it means the world to the entire team at Parallax, who I think works very hard to put these episodes together. As well as, I just have a presence on social media. I think a lot of effort goes into creating those social media constructs. So, so congratulations to the team at Parallax for all the kind words that Dr. Anavekar has said about us. And Nandan, with that, let's just dive into the topic of our discussion for this episode, which is postgraduate medical education. And you sort of live this role every day. So I think before we get down to some of the philosophical and theological backgrounds of education and the Gurukul, tell us about your life and your day as a program director.
Yeah. I thank you for the question, Ankur. So I began my role in the position of program director in the midst of the COVID pandemic. It was around March of 2021. And I remember when I was interviewing for the position, and I remember one of the questions was, why do you want the position? And I said, I remember distinctly because this answer I was reflecting on well before I was asked the question. And I answered, I actually don't want the position for the sake of the position, because we all have goals in mind. And if the position is the goal, then what am I going to do with it apart from use it for my own betterment? But rather, the position should be a means, and the goal should be different. And for me, the goal was to be a part of the process, the paradigm, or the construct that serves for the betterment of our trainees and their experience and how they mature from the beginning fellow to the one that can independently and autonomously practice as cardiologists within society. Furthermore, I think that every program is sort of like, an autonomous machine. And I don't think a program needs a director for education per se. And I know that's a very profound and probably controversial statement. But I personally feel, and I feel strongly, that the role of the program director is to cultivate culture. It's to cultivate culture of the program such that when a trainee is able to graduate from the program and work independently, that trainee is no longer just a fully fledged cardiologist, but becomes a role model in society, a role model to those who I perceive to be the most important in our society. And those are the kids. And the perspective I have is that, these graduates should not be a role model for kids to become physicians, but a role model for kids to see how one should behave, from an ethical sort of standpoint. So again, since beginning as a program director, now into my third cycle, I've taken my part or my vision to cultivate culture, to cultivate a vision of community, to harmonize that role of every individual being to serve the one next to them so that we can all progress, to cultivate a spirit that is no longer competitive, but rather cooperative so that we all succeed, that somebody's success becomes my success, rather than seeing everything from the perspective of what I can gain. And as part of that is some of the traditional education that leads one down the path of autonomous practice. And I guess that would sum up, a little bit in a long-winded fashion, what my day-to-day sort of thoughts have been as I take this very, this position, which I take very seriously.
Great answer. And as you were describing, your interview and what was asked as to why you wanted the position, and you've beautifully put the position to serve a meaning rather than be the goal, and that's just so eloquently put. I think all of us should, whatever positions we're seeking for, just aspire to have that mindset for those positions to serve a meaning rather than be the goal. What I was thinking when you were describing the interview was just the magnanimity of the place where you're at, the Mayo Clinic. And the Mayo Clinic, certainly every single one of us within cardiovascular medicine has interfaced with the Mayo Clinic videos. They're sort of the Mayo videos, right? That's the slang, the popular slang. Did you listen or did you watch the Mayo videos? So, what I'm trying to get at is that the Mayo Clinic has been at the forefront of education and has done a really good job in putting educational content together for a very long time, whether it's in internal medicine or whether it's in cardiovascular disease or even, echocardiography, interventional cardiology. I think for the purposes of certification and recertification, I think the nation listens to the Mayo Clinic videos or watches them. To be at such an important role in an institution which has such a legacy for education, I wanted your insights on that before we start delving into some of the finer details about education and postgraduate medical education.
Yep, wonderful. So first and foremost, being at Mayo, I think for me is a privilege and it's an honor. And I think being at any institute for that individual should represent a privilege and an honor. One of the things I've observed being at Mayo is not simply the effort that Mayo faculty or physicians place on education. It's actual devotion, and that's a major lesson for me. And that lesson is that whatever you do, whatever duty you undertake, it should be undertaken with a sense of devotion.
What I was wanting to ask you was the email exchange that we had, and Nandan, you raised a few points on how postgraduate medical education and the role of the teacher has been glorified in modern times, and sort of the teacher has become the celebrity, which I know that, based on how you responded to the question that was asked in the interview when you were taking on the role of the program director, it goes against the ethical principles of the role being or the role serving a meaning in your life. And I think what you commented in the email really struck a chord with me. And I really want you to elaborate on that aspect.
Absolutely. I think if we reflect back to how we all got into medical school, we're all sort of high achievers, at a young age. We're driven by a lot of factors, and I think initially that's a very constructive drive to have. It leads us towards the goal to get to medical school, goal to get into a residency program, goal to get into fellowship. But the problem is along the way to that goal, we become accustomed to the idea of what we are worth. And that worthiness comes from a measurement of the accolades that are bestowed upon us. And then I think as we mature with those accolades, we rest on those accolades to show our superiority compared to others around us. And I think that's a part of our profession. I think that's a part of, life in general that can hinder us from actually getting the very best out of ourselves and out of those who we are responsible for. Now, when it comes to the teaching space, what I've noticed, and you mentioned it, I use the words that the teacher has become the celebrity. And I think that, we are so fortunate that we have, some amazing teachers out there. But the teaching space has been one where the teacher has been central and has been sort of prioritized as the meaning behind every encounter. And how I came to this conclusion was really very funny for me or amusing, is because when I went to my son's preschool and I saw how I observed how effective his preschool teachers were, I just noticed that the paradigm was in reverse, where the kids were really the center of this framework. And I look back at the fellowship program and then at other meetings where we go to, how we highlight, reams of preamble of, all the accomplishments of a given individual, well-deserved, albeit well-deserved. But we make that an emphasis, in the teaching space. And I think that, we may be better off, or we should at least consider, what if we turn that paradigm around, and learn a few lessons maybe from the preschool sort of precept, in terms of, the teacher is important, obviously very central, is an important ingredient to the learning environment. But let's not emphasize all the accolades of the teacher, but rather let's simplify the learning environment to focus on exactly what the needs of the learner are. And I think that's a complex, sort of, concept, to sort of think about and process. But I think that the, concept, gets a lot more, granular and easy to digest, once we look at some of the philosophical origins of the learning environment and what exactly a learning environment is. And really, so, in a nutshell, I think that, emphasizing the learning environment, as the centerpiece, in which the learner is given, the preference, and where the teacher is given the platform, I think we can become more effective.
Yeah, no, I think what you describe here, and as you were describing, I just I was reflecting on the meeting I had with the teachers, my son's teachers, who's in kindergarten and he's going to be first grade now. Is that, we the focus is the learner, and the focus is not the teacher. And it's, I think these teachers play such an important role in shaping up the lives of our kids and in teaching them and educating them, and they'll become, the future, doctors and engineers and leaders, what have you. And these teachers, of course, have such an important role in society, right? Crucial role. But I don't see, the infrastructure, like the schooling or the educational, and I'm sure there are awards and richly deserved awards, and as there should be, but to the extent where we glorify teachers in medicine, I think in general has gone too far compared with, some of the other really important, human beings who serve as teachers all their lives, and whose primary responsibility and job is to teach the kids, right? Those are such important people in society, really. And they don't get, they don't get to be put on a pedestal as high as physicians who question our great teachers. Then how do you focus on this paradigm to shift, with the focus on the learner and not the teacher? How do you do that within your own construct as the program director? And how do you foster that culture in your colleagues, who I'm sure will serve as teachers for your fellows?
Yeah, absolutely. I think that's an important question. And it's an important problem, right? Like, how do we, be a part of a process that centralizes or emphasizes the learner? And so I can only speak to what I've sort of been involved in and the vision I have. And I think the first thing is, my participation is nothing of original thought. It's all come from my studies in human philosophy, specifically, the works from the Vedic literature, where it actually maps out and defines what a learning environment is. And first and foremost, something that struck me, because I've been guilty of saying it, I've always said how I self-study and I've self-learned this. And it was really profound in this literature where they have gone far to say, or the literature, philosophy states that there's no such thing as self-learning. There is a concept of self-study, but only studying what you've already learned. Meaning that you can't just pick up a book and learn something, because picking up a book means or implies a couple of assumptions. One, that you know how to read. Number two, that you understand what is being conveyed as it was meant to be understood. And we know that many a times when we read something, we may have understood something, but we may have understood it in the wrong way. And so therefore, in this sort of Vedic philosophy, it really intimates that the first sort of transaction in the learning space is between a teacher who then imparts the knowledge to the student. And in fact, one of the paradigms has been knowledge as flowing water, right? As a river flows from high altitude to a low altitude, so too knowledge should flow from that teacher who comes from a space of higher knowledge and flows down or is imparted to the student who is downstream of that. Now, for that to occur, you actually need to afford time for teachers to teach, and that's really tough, right? Because we're all being, pulled in all different directions. But a mandate that has been supported by, the leadership where I work, is to provide time for teachers to be with the students, the trainees and the fellows, to be able to teach. Now, the second part of this to be effective is that what we teach should not be assumed, right? We should not assume that a student comes to us with a certain knowledge of a topic. And for that reason, I tend to try to construct my lessons focused on the novice, which means that any term that I'm used that is out of the vernacular, I think it's important to define. And so we come up with a definitional construct of a lesson. We come up with objectives. What is the goals from the lesson that we're trying to convey here? And then the next part is, once we have provided the lesson, we need to establish a safe space where the learner can ask questions, because questions intimate that what is being conveyed is being processed by the mind. And so questions are really a surrogate of an individual, of a learner trying to understand and cement that knowledge. Now, philosophically, there are three words that are used in Sanskrit. The first is shravana, the second is manana, and the third is nididhyasanam. And all three are integral parts of this learning environment. Shravana refers to just listening, okay? And that's the interaction of the lesson. That's where the student listens to the teacher who's trying to impart the knowledge. Manana is actually when the knowledge is being received in the mind sort of tries to or naturally raises doubts, and those doubts rise to the surface as questions. And as the learner asks questions, the teacher is then responsible, has the duty to resolve those doubts with a sense of consistency. And then the final part, which in our profession, in the sort of the true meaning of the word nididhyasanam is to be contemplative or meditative, on that which is being understood. And for us in our profession, that means practicing, right? That means taking what you've learned, what you've understood, and then contemplating that, whether it's, at home and you're reviewing a book, or whether it's on the wards and you're treating a patient and you're looking at the problem and putting that lesson into practical terms. That is cementing that knowledge so that it becomes a part of the learner. And so, as I mentioned, it's an important problem that you've brought, to this conversation. And as I say, this is what my approach is. I have to negate that. It's not my approach at all. It's basically what I've learned from an very ancient literature, and what I'm only doing my best with the utmost humility to bring into practice and see whether it works for the students that I'm sort of participating with.
Yes, and then I think an important component of your role is also to, I think, for lack of a better word, just cater to the audience that you are teaching, right? Because there's a spectrum. You have the general cardiovascular disease fellows, then you have the advanced, fellows, whether it's in electrophysiology, interventional cardiology, cardiovascular imaging, or advanced heart failure and transplant cardiology. And then you also have residents, you have the house staff, you have medical students, you have, people in different stages of their career development. An important role for the teacher is then to also, for lack of a better word, cater to the audience that the teacher is trying to teach a particular topic to, because there's a wide spectrum there, with people in different, stages of career development, from medical student to house staff or residents to fellows, and even within fellowship, different stages of fellowship. From year 1 to year 3, and then the advanced fellowships, in electrophysiology and interventional cardiology and cardiovascular imaging, advanced heart failure. So how do you cater to the audience that you're teaching a topic to?
Yes. I think it's important, and you're right. Even the learning is very complex because everyone's at a different stage. And so with my sort of role, at the general fellowship level, obviously we're sort of, there's a lot of conferences, right? And there's a limit to how many conferences or educational didactic time that we can have. We're very fortunate at Mayo that we do have a lot of different conferences available with different emphasis. So there's an EP didactic session that the EP group have. There's a interventional, there's imaging. We have the general ones. And for me, what I do is a couple of things. For the general fellows, again, I try to focus my attention to the entry-level learner, and so without any assumptions. But then the other thing that we do at other conference times is I get the learners who may be a little bit more advanced, who may be, for example, in imaging as a subspecialty or an intervention or an EP, and I say, well, now I want you to teach a specific topic in EP, but at the level that's suitable for an entry-level learner. So with that task, yes, they are teaching an entry-level learner maybe some basic imaging in CT. But in order for them to do that, they have to be able to be prepared, and they're learning within their own sort of advanced level or area of specialty, something that they may have not have initially mastered. So I think it's trying to take advantage of the strengths of different members of the training program, and then highlighting that and giving them an opportunity to teach. And it also exposes them to the challenges of teaching that we all face, and it provides them an opportunity to sharpen some of their tools. And I think that as our profession continues to expand in terms of, niches of practice, having some process where we can diversify the teaching space and the learning environment will become a necessity, a challenge that we're all going to have to face, and that we're going to have to work together with collaboratively across institutions. And I think this brings up the idea of going away from the brick and mortar learning space and developing such a collaborative inter-institutional learning environment where we bring teachers who are passionate about teaching, who are emphasizing the learner in the same community as the learners who value that which is being taught. And the key here is that for knowledge to be conveyed, we need qualified teachers, indeed, who are passionate about teaching, who have a wealth of knowledge that they want to convey. And the qualifications of the learner is one who is seeking and values that knowledge which is being imparted. And I think our profession is certainly at that point. And I think we learned some big lessons from COVID that we should aim to transcend the brick and mortar institutional paradigm.
Yes, which is, I think, a great segue for me to briefly discuss about GCU. And I do know that, we will be following up this episode with an episode on GCU, because this is sort of the concluding episode for the mini-series. Tell us more about Global Cardiology University. And for the listeners, GCU stands for Global Cardiology University. And it's an effort on part of Dr. Anavekar and his colleagues to democratize medical education, and something which he just briefly talked to us about. So, Nandan, can you elaborate on GCU and your vision and the effort to democratize medical education?
Yes, absolutely. So, Global Cardiology University is an effort that I've got to say I participate in. It is moving forward, in a manner that I'm really proud of. And it's moving forward only because of Herculean efforts of so many people. And it really is a space where teachers and learners have really come together to form, I think, a community. So it's not a platform where we just see lessons being put together, but we really see it as a growing community, a community where we all value each other for what is brought to the table. Now, I have to mention a name, Dr. Anthony Kashu. His history goes back a long way, and he's otherwise known as the EKG guy. And he's really paved the way, in terms of what we do, in the, ECG sort of teaching space. So much so that he's actually been a part of a major randomized controlled trial called the Educate trial, looking at how we teach ECGs and whether we should be doing things differently. And he's developed this platform, which we house GCU on, and it's very learner-centric. And as part of that, with this team, which now consists of several teachers and a growing number of trainees from all over the country. And if I'm correct, I think we have several learners from across the globe, including the Middle East, India, and other parts of Southeast Asia. And what we have accrued to date is obviously the full ECG curriculum, really developed by Anthony Kashu, a very robust general cardiology and echocardiography curriculum, each lesson with its own set of learning objectives and goals, each lesson with a set of quizzes and questions and everything backed by learner statistics. So a learner can see how he or she is progressing and what gaps there may be. The team is also developing flashcards to again foster that learning process. I think the most powerful part of this is the community, and again, we have teachers interacting directly with students, and the students could be somewhere so remote from where the teacher is, and vice versa, which I think is just absolutely beautiful. I could be getting questions from a learner in India at opposite ends of the 24-hour day, but I can still answer that question in real time. Most recently, we did a didactic lesson for some students at the University of Jordan, and I had just the most unbelievably fun time. I remember this very vividly because it was a snowstorm and I had the lesson conducted from my basement, and it was early morning for me and it was the end of the day for the students who were all online. And we interacted directly just as a teacher would, in a classroom. And so Global Cardiology University, it's a resource that's out there. Certainly I'm not proposing that it is the, be all and end all or a replacement for anything. I see that it's an additional tool, and I see it as an additional tool from which we can understand the world we're living in. Like, for example, how do we as human beings interact with the universe that's around us? It's through our through our sense organs, right? We see, we hear, we touch, we taste. And all of those organs of sensation take the world and presents it to our mind, which then brings up a perception, right? And based upon that perception, we interact with the universe. And similarly, what I say about GCU is that it indeed is it's another instrument. It's another instrument that I hope will serve the individual learner to understand the world of knowledge that they are interacting with, and helps them to get the best out of themselves as a learner, and may instill the motivation for them to participate at a future time as a teacher. Because indeed this profession, it's in my opinion, it's an organism. It's a living, breathing organism, and we need to nurture it. We need to look after it. We need to make sure that we look after each other as the best mechanism of looking after our profession.
Yeah, no, excellent closing remarks there, Nandan. And I couldn't agree with you more that I think nothing can supplant anything else. I think, and it also caters to how we are as learners. I think some of us, learn through audio. Some of us learn through a textbook. Some of us will learn through videos. Any closing remarks for our mini series, Nandan? I know this is the last episode, and for the listeners, please share your feedback with us. Both Dr. Anavekar and I are very keen on learning how you've interacted with these with these episodes, particularly this mini series, and whether you want us to focus on some topics which you feel deficient in, or you feel that we need to discuss more about. Please feel free to reach out to us, and we'll do our best to put another mini series together. But any closing remarks here, Nandan?
I guess my closing remarks, especially culminating in all this being the third conversation that we've had, is that especially to those who are training out there, you guys are all amazing individuals. You've entered into a profession that at its core really provides an opportunity for you to become leaders, to become individuals that contribute to the progress of our society, not just our profession, and understand that each and every one of you is an absolute miracle, and you will have ups and downs. But as long as you stay true to your moral compass that you continue to help those around you, whether it's your patients getting over an illness or whether it's your peers getting over, an adversity. And as long as you do not search for a particular outcome, but accept every outcome as an opportunity for yourselves to grow, you've already guaranteed yourself success. Finally, I would convey that try to reset your approach away from a competitive perspective to a more collaborative perspective. Help those around you. As I learned from a lecture from Swami Vivekananda, there are really only two classes of people, a class that struggles and a class that helps those who are struggling. And the beauty of this classification is that we all belong to both classes. We will all face challenges and are blessed with those who reach out and help us. Similarly, try to be that blessing in someone else's life who may be struggling. With that, Ankur, again, just thank you so very much for having these crucial and meaningful conversations. I have certainly grown from the experience, and I look forward to listening to your podcast well into the future as a learner. It really has helped me so much. So thank you so much, Ankur.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.